Hi, this is Dr. Jaitly. In this particular section, I'm going to be talking to you about what's an EKG. An EKG is an electrocardiogram. That's the complete form of EKG. It's a test that's recorded on a strip of paper, and the paper runs across the machine. The machine is almost the size of your laptop, and it records the electrical signals originating from the heart. And each heartbeat propagates a signal on the paper. So here is a signal beat. It's called beat, beat, and a beat. Okay, so that's a normal pace. The normal pace for the heart is about 70 to 80 per minute. In other words, the heart will beat about 70 to 80 per minute in your adult heart. If you're a child, the heart may beat very rapidly. It can go up to 110, 120. And it could be normal for an infant. And if you're elderly, obviously, then the heart may be beating slower or sometimes irregular also if there is a disease in the heart. So a lot of the times, just by a simple test on an EKG, the doctor can learn a great deal about how your heart rate and heart pace is, and based on that, further testings can be done, and several things can be ruled out or ruled in depending upon what the doctor is suspecting when you are going and seeing him for various complaints. Now, a normal paced heart, as I said, runs about 70 to 80 per minute. Now look at this. This is the second example where the heart is beating more rapidly. Beat, 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 beat. You see that? So that's a fast heart pace. And here the heart pace or heartbeats are about 110, 120 per minute. As you see, it's faster than the strip above. Then you have the third strip. Here the heart rate is very slow. Beat, beat, beat. You see? So that's a slow heart pace. Here the heart rate may be only about 40 a minute. And then you have an irregular heartbeat called the I, and this is the fourth example where the beat is beat, 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 beat. You see how irregular that is? It's sounding irregular also while I'm saying it. So the reason I say that is also to define exactly what it sounds like. So you have a normal paced heartbeat, you have a fast paced heartbeat, you have a slow paced, very slow heart rate, and then you have an irregular heartbeat. Now each of them, they connote different, they tell the doctor different information, but the fact is that only an EKG can help tell us what's going on as far as your electrical beats or electrical complexes or your heart pace is concerned. So anyway, what have you learned from this test, from this video snippet? Well, EKG is a very simple test. It does not hurt. It takes only a few minutes to get it done in a doctor's office if the doctor ordered it. It's normally done by a technician or a nurse by applying various leads to your chest and to your arms and legs. Sometimes they apply a little bit of paste also to have the leads stick to your arms and legs and chest. And then the doctor gets to read it after a few minutes once it's printed. And based on which, what the doctor sees, what's going on your strip, can decide to order further tests or decide to treat you. As simple as that. So if your doctor ordered an EKG, you know now it's a very benign test, takes only a few minutes, and the doctor will get you an answer right there in the office itself after reading what your heart pace is. So basically it's a test to read your heart beats and electrical signals that originate from the heart. Thank you, and I hope you enjoyed this one, and let's go into more details at a later time. Okay, thanks, bye.